Watch your mouth.
All right, we're back with Dr. Ryan Walker. He's our dental expert here at HTV. We rely on him to give us some great information. Doc, always good to see you.
Good to see you, Martin.
You know, we talk about dental implants. God, we've heard it for so many years. So as a dentist, you almost, for lack of a better word, you almost got to be part construction guy. You got to have knowledge.
Mechanic, yeah.
Kind of. Engineer.
Right.
You got to sort of make it work. But just basically, what's a dental implant? How does it all work?
Yeah, so, nowadays people can get all kind of implants. Today we're going to talk about dental implants. Yeah. Dental implants, very simple. It's just a roughened titanium screw, textured or etched titanium screw that's placed in the jaw. That's it. It's used to replace either a tooth or multiple teeth. You use them to anchor things on, and that's it. It's
let's
simple.
pull up one because it looks fairly.
Yeah, so that's
simple.
it. So what you see there is just both components. You see the implant, that screw-looking thing, that is the implant. And then on the other side, obviously, that's what we call the crown or the tooth. And that abutment and tooth, we call it screws. You can see the screws onto the inside of the implant, and that's it. And next one will be them made up. That's actually a little smaller implant that's supposed to be on that crown. That's just two components I had in the office, and I put them together. And that's what they look like together. And one more slide there. Yeah, and then you'll see what the top of the tooth looks like. There's the screw that holds it onto the implant. And that's it. It's pretty simple.
Then you fill in that hole.
And then you fill in the hole. Yes, sir. It's pretty simple.
Does it hurt?
Does not hurt. No. So
I was going to ask you that.
Absolutely. Yeah. So that's most people's question is, oh no, I don't want to do that. It hurts. It's less painful than having the tooth taken out, actually. So it's more traumatic to have a tooth taken out than have an implant placed.
Now, as far as, so you go get this done, but you got a job and you're working. What's the healing process?
So healing process, we call integration. We call it osseointegration, is when the bone actually fuses to the implant. And that happens over 3 to 4 months, typically. So you place the implant, let it integrate, come back. 3 or 4 months later, you torque out the implant. You put a wrench on it, you torque it out. And if the implant's integrated, it's not going to move, it's not going to go anywhere, you won't feel anything. And it's ready to be used.
So, but the screws and all are holding it in place. And you could do everything normal?
Do what you got to do. It's there, it's solid. Difference between an implant and a tooth is that an implant, the bone fuses to it, there's no wiggle room, there's no nothing. It is solid. Whereas a tooth is actually attached to the bone with the ligament. So all your teeth have a little bit movement, whereas an implant, no movement. You're not going to feel it. It's not painful. You don't feel anything.
Well, it's like fusing a hip or anything else.
Exactly. Same technology.
You're just immobilizing it.
Same technology.
Making it there. Well, do we have some slides of what it looks like in the mouth?
Yeah, we'll look at what it looks like in the mouth.
Let's check that out if we could.
Yeah, so this is actually an x-ray in the mouth of, you see the two natural teeth on the right side of the screen. And on the left side, that's two implants with crowns on them. And that's what the x-ray looks like. You see the bone level down low. And then go to your next x-ray. So here's another x-ray. That's what we call a healing abutment. So when you place the implant, while it's integrating, you can either cover it up completely with the gums, or you can put this little healing abutment on there that pokes up through the gums. And the next slide is a picture of it. So that's what the healing, that x-ray is, that's what you're looking at here, and that's the healing abutment coming through the gums. And then once it's healed, keep going. That's what the platform of the implant looks like. And then next, and there you go. There's the tooth that goes on it. You put a filling in the access hole, and that's it. Functions as a tooth.
Well, y'all got so good at making that look like a real tooth. It really, in essence, is a real tooth, isn't it?
It is. It's a great service for the patient. It works extremely well. It's really, really fortunate to have that for people these days. It's a great service.
Any age group that normally starts coming in, or is it all ages?
All ages. Could be anything. A lot of it's trauma. You know what I mean? There's a lot of people that have trauma to the front of their mouth and lose a front tooth. Implant's a good option. You just have to have enough bone to place the implant.
Now, I see football players still today in the NFL. They got that mouthpiece stuck in the helmet, and they're out there at the line of scrimmage, and it never leaves their helmet.
Yeah. So I saw some trauma this last week from a cheerleader, and it's amazing how many sports don't require a mouth guard, but a lot of them should.
Well, you're right. You talk about that. There are a lot of sports where
every sport but football.
Yeah.
I mean,
guess like soccer, neither.
no.
Soccer to me is one of the more violent sports.
Football's the only sport required to wear a
That
mask.
soccer ball coming at you at about 90 miles an hour.
Or somebody's head or an elbow.
Yeah. That's
Yeah,
incredible.
so we see a lot of trauma in dentistry from sports and just everything else. I mean, you name it. But and implants are
Yeah.
a great solution when you don't have a tooth anymore.
So people, do they come to you right away, or do sometimes they wait and say, I'll go a little later?
Oh no, come right away.
Right away.
Right away.
You could do better if you get it right away, right?
If you get it right away, much better for trauma. Sooner the better.
Okay. Because otherwise you have to.
Preserving bone is everything because if you don't have the bone to place the implant, we can't place it. So
That's true.
Or you got to have the bone to place the implant in.
So there's a point of no return.
Yes, sir.
All right. So good. Do you do a lot of these every day?
Yes, sir.
Yeah.
Yes, sir.
I guess
great
along with
service.
your regular practice, you just,
Yes, sir.
it's part of being a dentist, right?
Yep, all part of it.
Always good to see you, Doc.
All right, thanks, Martin.
All right, there you have it, Dr. Ryan Walker, and there we showed you what dental implants are all about. And if you're looking for a good dentist here in the area, one sitting right next to me is a good guy too. He's involved in the community, so give him a call. We appreciate him coming on and being our dental expert here at HTV. And we will see you again, the same place, same time, as we run these also on Facebook and YouTube for you to digest them and see what you have to do next. We'll talk to you next time.
Watch your mouth.